It is estimated that about 32 million Kenyans are at a high risk of malaria. But the just released WHO Malaria Global Report is showing some good signs. There has been remarkable improvement in malaria surveillance in the country. Malaria Surveillance System essentially means having kits to detect and test for malaria, procedures, people and structures that generate information on malaria cases and deaths.
In the past year, 2 years, actually the DHIS system, the system that records and reports cases, has been dramatically improved. So in fact the problem is not the reporting of cases now, but the problem was with the reporting of cases before.
The report showed that there were 7,676,980 reported and confirmed cases of malaria in 2015 in public hospitals, and 46,019 cases reported in private hospitals, and a further 82,141 reported cases from the community level.
Numbers like only 700 cases being reported for 2013, that's not possible. There were many, many more cases. So in fact, this apparent increase that we are seeing at the moment, or that's being shown here, is an increase of reporting, not an increase of cases.
Researchers attributed the higher numbers to what they term as an effective surveillance system to diagnose, detect and report malaria cases in the country compared to other nations in Africa. And that effectiveness was portrayed in the number of reported malaria deaths cases in the country. Kenya is ranked second country in the continent with the highest number of reported cases of malaria at 15,061. Democratic Republic of Congo had the highest number of reported cases of 39,054. According to WHO, malaria surveillance is currently weakest in countries with the highest malaria burden. For instance, Nigeria, which has the highest share of deaths related to malaria in the continent at 26%, had 0 reported cases, whereas there is 5% share of deaths of malaria in Africa from Mali and 4% from Tanzania. There were 1,544 and 6,313 reported deaths respectively. Despite Kenya having 3% shared malaria deaths in the continent, the report shows that there were 15,061 reported deaths in 2015. The increased funding by the Kenyan government from 117,880,400 Kenya shillings in 2014 to 152,020,500 in 2015 has also been cited as playing a role in effectiveness of malaria surveillance system in the country.
Well, in fact, the information is critical. Unless we've got proper information, we can't actually go after the disease properly. So improving the reporting of the disease is actually one of the main steps. Unless we get proper reporting and proper estimation of the cases, we can't properly deal with it. So it's part of those strategies that are being put into place by the Kenya Malaria Strategy to actually improve reporting, and as a result of that, we'll be able to deal with the disease much better.
Eunice Omolo, NTV for the Health Assignment.